Back pain that gets worse every time you breathe in is one of the most unsettling experiences a person can have because breathing is something you cannot stop doing. Every single inhale becomes a reminder that something is wrong. But the good news is that in the vast majority of cases, back pain with breathing has a very specific and very treatable musculoskeletal cause. In this video, I'm going to cover every major reason back pain worsens with breathing, how to identify which cause applies to you, and the exact steps to get lasting relief. Why breathing triggers back pain. To understand why breathing causes back pain, you need to understand the anatomy involved. Your rib cage is not a fixed, rigid structure. Every time you inhale, your ribs expand outward and upward to create space for the lungs to fill. Every time you exhale, they return inward and downward. Each rib connects to the thoracic spine, the mid and upper back, through small joints at the back, and either connects to the breastbone or surrounding cartilage at the front. This means that every single breath moves the thoracic spine. When anything within this system is inflamed, restricted, strained, or injured, each breath becomes a mechanical trigger for pain. Causes of back pain when breathing. Number 1. Rib joint dysfunction. This is the most common cause of back pain that worsens specifically with breathing. Each rib attaches to the thoracic spine through two small joints at the back, one at the vertebral body, and one at the transverse process. When one or more of these rib joints becomes restricted, inflamed, or slightly displaced from its normal position, which can happen from a sudden twist, poor posture sustained over time, sleeping in an awkward position, a forceful cough, or even sneezing hard, every breath that expands the rib cage pulls directly on that irritated joint. The result is a sharp, catching or stabbing pain on one side of the mid or upper back. That spikes with every deep inhale and eases when you take deliberately shallow breaths. It often feels like something is stuck or out of place at a specific point in the back, and pressing on that exact spot usually reproduces the pain clearly. This is one of the most treatable causes on this list and responds very well to targeted stretching and mobilization. Number 2. Thoracic muscle strain. The muscles running alongside the thoracic spine and between the ribs, called the intercostal muscles, expand and contract with every single breath you take. When these muscles are strained or in spasm from overexertion, heavy lifting, repetitive twisting, or a sudden awkward movement, the act of breathing stretches the injured muscle fibers with every inhale and generates pain at the site of the strain. This pain is typically localized to one area of the mid or upper back, is tender when you press into it, and worsens with deep breathing, coughing, and sneezing. Unlike some of the other causes, this type of pain always has a clear starting point, a specific activity, movement, or session of exertion that preceded it. It usually resolves within 1 to 2 weeks with consistent self-management. Number 3. Poor posture and thoracic stiffness. When the thoracic spine is chronically rounded and stiff from prolonged sitting, desk work, or years of forward head posture, the rib joints lose their normal range of movement. The joints stiffen from lack of use, and the surrounding muscles shorten and tighten around them. When this happens, the ribs can no longer move freely through their full expansion range with each breath. Instead of a smooth, painless expansion, each deep inhale meets resistance in the stiff joints and restricted muscles, creating a dull, aching tightness across the mid-back that consistently worsens whenever you try to breathe deeply. This is a slow developing cause that builds gradually over months and years of postural neglect and is one of the most common reasons people notice mid-back pain getting worse when they try to take a deep breath at their desk. Number 4. Costochondritis. Costochondritis is inflammation of the cartilage that connects the ribs to the breastbone at the front of the chest, because the ribs connect both to the breastbone at the front and to the thoracic spine at the back. Inflammation in this cartilage creates a pain that can be felt in both the chest and the mid-back simultaneously. The pain worsens sharply with deep breathing, coughing, or any physical exertion that moves the rib cage. The front of the chest is typically tender to touch at the point where the ribs meet the breastbone. Costochondritis often follows. A respiratory infection, a period of intense coughing, or unusual physical exertion, and usually resolves over several weeks with rest and anti-inflammatory management. Number 5. Pleurisy. Pleurisy is inflammation of the pleura, the thin, two-layered membrane that surrounds the lungs. When healthy, the two layers of the pleura slide smoothly over each other during breathing. When inflamed, the layers become rough and create friction with every breath, generating a sharp, stabbing pain that is felt in the chest and frequently radiates directly to the upper back. Pleurisy pain is distinctly worse with every inhale and noticeably eases when the breath is held. It is frequently accompanied by a dry cough and a tendency to breathe shallowly to minimize pain. It usually develops following a respiratory infection such as pneumonia, flu, or a viral illness. Pleurisy always requires medical assessment and treatment. It does not respond to the musculoskeletal fixes further in this video. Number 6. Vertebral fracture. A fracture in a thoracic vertebra, whether from a fall, a sports impact, or osteoporosis-related bone weakness in older adults, causes intense back pain that worsens sharply with every breath because rib movement mechanically loads the fracture site with each inhale. This type of pain is typically severe, came on suddenly following an injury or impact, and does not ease meaningfully with any position or self-treatment. In people with osteoporosis, vertebral fractures can occur from surprisingly minor events, a heavy cough, a stumble, or even bending to lift a light object. Any sudden, severe mid-back pain that worsens with breathing following any kind of trauma or impact requires immediate medical imaging. Number 7. Pulmonary embolism. A pulmonary embolism is a blood clot that has traveled to the lungs and blocked blood flow. It causes sudden chest and back pain that is sharply worse with breathing, combined with shortness of breath, rapid heart rate, and sometimes dizziness, coughing up blood, or a feeling of impending doom. This is a life-threatening emergency that kills within minutes to hours if not treated. If your back pain when breathing came on suddenly and is accompanied by any difficulty, breathing, chest pain, or a rapid heartbeat, do not continue watching this video. Call emergency services immediately. This is not a condition to manage at home. How to tell which cause applies to you. If the pain is a sharp, pinpoint catching sensation on one side of the mid-back that gets worse, with deep breathing and you can press on the exact spot to reproduce it, rib joint dysfunction, or a thoracic muscle strain is almost certainly the cause. If the pain is a broader, diffuse, aching tightness across the mid-back that worsens when you try to breathe deeply at the end of a long day at a desk, thoracic stiffness from posture is the driver. If the pain is in both the chest and the back and the front of your chest is tender to touch near the breastbone, costochondritis is likely. If it followed an illness and feels like sharp friction with every breath, that eases when you hold your breath. Pleurisy needs medical assessment. If it came on after a fall or impact, see a doctor for imaging before applying any self-treatment. Exact solutions: how to get rid of it. The following solutions apply to the musculoskeletal causes: rib joint dysfunction, thoracic muscle strain, thoracic stiffness, and costochondritis. If your pain is severe, sudden, or accompanied by any breathing difficulty, seek medical assessment first. Fix 1. Thoracic extension over a chair. Sit in a firm chair and place both hands behind your head with fingers interlaced. Gently arch your upper and mid-back over the top of the chair's backrest, opening the front of the chest and decompressing the thoracic joints and rib attachments at the back. Hold the extended position for 10 seconds. Do 10 slow repetitions. This directly mobilizes the stiff rib to spine, joints, opens the restricted thoracic segments, and restores the rib mobility needed for pain-free breathing. Most people feel an immediate improvement in the comfort of breathing after just a few repetitions. Do this twice daily and whenever the back tightness worsens. Fix 2. Deep rib expansion breathing. Place both hands on the sides of your rib cage. Inhale slowly and deeply through your nose, focusing on expanding the ribcage outward in all directions, sideways, forward, and backward like a barrel expanding. You should feel your hands being gently pushed apart. By your ribs, hold at the top of the breath for 3 seconds, then exhale fully and slowly. Do 10 slow repetitions 3 times daily. This exercise gradually mobilizes restricted rib joints, stretches the intercostal muscles between the ribs, and trains the breathing pattern back toward full expansion. It feels counterintuitive to breathe deeply when breathing hurts, but performed slowly and gently, this is therapeutic rather than aggravating and is one of the most effective tools for restoring pain-free breathing. Fix 3. Thoracic rotation stretch. Sit upright in a chair with your feet flat on the floor. Cross your arms over your chest, slowly. Rotate your entire torso to the right as far as comfortable. Hold for 15 seconds, then rotate to the left. Do 10 repetitions in each direction, twice daily. Thoracic rotation mobilizes the facet, joints of the thoracic spine and the rib attachments on both sides simultaneously, restoring the full rotational and lateral freedom that allows the ribs to expand freely during breathing without catching or pain. This is particularly effective for rib joint dysfunction and for thoracic stiffness, driven by prolonged sitting. Fix 4. Heat therapy on the mid-back. Apply a heating pad to the painful area of the mid or upper back for 15 to 20 minutes. Heat relaxes the intercostal and thoracic muscles, reduces joint inflammation at the rib. Attachments increases local blood flow to accelerate tissue healing and makes breathing noticeably more comfortable. Always apply heat before performing the stretches above. Warm tissue mobilizes significantly more easily and responds faster to movement than cold, stiff tissue. The combination of heat followed immediately by the thoracic extension stretch and deep rib breathing produces faster relief than any of these methods used independently. Fix 5. Sleep position correction. If your back pain when breathing is consistently worse in the morning and improves through the day with movement, your sleep position is aggravating the rib joints for the entire night. Sleeping on your stomach locks the thoracic spine in rotation and compresses the rib joints on the side you are lying on for 6 to 8 hours. This is one of the worst positions for anyone with thoracic or rib-related back pain. Sleep on your back with a pillow under your knees to reduce spinal load, or on the pain-free side with a pillow between your knees to keep the rib cage level. These positions allow the rib joints to rest in a neutral, decompressed position overnight and wake up with significantly less stiffness. When to seek emergency care. Call emergency services immediately if your back pain when breathing came on suddenly, alongside shortness of breath, chest pain, rapid heartbeat, dizziness, or coughing up blood. These are signs of a pulmonary embolism. Also seek urgent medical care if the pain followed a fall or impact, if you have a known history of osteoporosis, or if the pain is severe and not improving after several days of self-management. For any back pain with breathing that worries you, always get assessed by a doctor before applying home treatment. That is everything exactly why back pain gets worse when breathing, how to identify your specific cause, and the exact steps to fix it. If this video helped you, hit the like button and subscribe for more back pain relief content every week. Comment below and tell me whether your pain is a sharp catching sensation or a dull aching tightness, and whether it is worse on the left or right side. I will reply and help you identify the most likely cause in your case. I will see you in the next one.